Professor Padmanabhan Balaram, a renowned biochemist, is Professor of Molecular Biophysics and former Director of the Indian Institute of Science, Bengaluru. His main research interests are in the fields of bioorganic chemistry and molecular biophysics. Professor Balaram graduated in chemistry from Pune University, following which he did his master's in chemistry from IIT Kanpur. In 1972, he received his PhD degree from Carnegie Mellon University, Pittsburgh, USA. He also underwent postdoctoral training in chemistry at Harvard University, USA. Professor Balaram is the author of more than 400 research papers. He has served on the editorial boards of science journals, both national and international. He has received many awards in recognition of his work. Prominent among those are Indian National Science Academy Medal for Young Scientists in 1977, G.D. Birla Award for Scientific Research in 1994, Shantiswarup Bhatnagar Prize, the celebrated award for scientists from CSIR in 1986, Padma Shri from the Government of India in 2002, and Padma Bhushan from the Government of India in 2014. It is indeed an honor to have you with us here, sir. I now request Professor Balaram to deliver the much awaited talk.
Good morning. When Shreyas and friends came to invite me to come and speak to you, they said that they wanted to have a meeting which discussed the issue of whether science is important or whether societal understanding of science is important. So I thought I would talk to you. I will try and emphasize why it might be important for everybody to understand a little bit of science. But before I do that, I want to ask you some questions. And I noticed that most of you are very, very young and you're all students. How many of you are students of science? Very good. So the majority of you are students of science. So it's even more important for you to understand science. And one of the difficulties that one often faces is that even scientists need to have an understanding of subjects in which they are not specialized. So I'll start with a problem which is current, and that is the problem of the Maggi noodles controversy. So how many of you like Maggi noodles? Majority of you. So since the majority of you like Maggi noodles, you have been directly affected by the banning of Maggi noodles. And the reason that Maggi noodles have been banned is because of an analysis which showed that the noodles now contain lead, which is one of the substances which had been estimated, and the other that it contained monosodium glutamate. Now monosodium glutamate is this molecule here, whose chemical structure I have drawn. That's what it looks like, and that's what the Japanese sell it as Ajinomoto. Ajinomoto is the name of a company. It's the name of a company which makes amino acids, and monosodium glutamate is one of its products. But over a large number of years, Ajinomoto, the name of the company, has become synonymous with the name of the material, that is MSG. Now MSG is supposed to have harmful effects, and if you look at the newspapers, today you can look at the newspapers of the past 1 month quite easily by going to the internet and clicking away. If you do that, you will find that one of the laboratories which did this analysis, a spokesman for the laboratory actually said, we have detected glutamic acid, but we don't know the connection to monosodium glutamate. Now I have drawn the two structures here. That is glutamic acid, that is monosodium glutamate. Glutamic acid is a substance which we all have. It's a constituent of proteins, and in any protein-rich meal, you will eventually end up ingesting a certain amount of glutamic acid. Glutamic acid is very important because it is a neurotransmitter in the brain. Too much of it can cause a problem, too little of it can cause a problem, and therefore glutamic acid is both essential but also something that is biochemically controlled. But here is where elementary chemistry, for instance, might be useful. These are two, they're the same substance actually. One of them is the sodium salt, the other one has the hydrogen here, so it's a carboxylic acid. But if you put the carboxylic acid in water, what will happen is it will dissociate and you will get exactly the same substance here as you have over here. So when you're measuring monosodium glutamate or glutamate, you're actually measuring the same thing. Now it also turns out that in the last few days, the analyses themselves have now been questioned. Because foreign laboratories have now shown that the analytical data on these substances on these materials may not be completely correct. But just for your general reading, I have taken a reference from the literature. I did this yesterday, a paper which appeared some years ago in a journal called Food Chemistry and Toxicology, which has done a study. And this study is on giving monosodium glutamate to substances and finding out whether there are to people, and then finding out whether there are any ill effects. And they finally conclude that rigorous and realistic scientific evidence in linking the Chinese restaurant syndrome to monosodium glutamate could not be found. What is interesting in this is that not only do you need to know a little bit of science, but it also is important to know a little bit of social science here. Ajinomoto is a Japanese product. Unfortunately, it is linked with Chinese restaurant syndrome, and it's the Chinese who get the blame for it. Now, yesterday, in preparing for this talk, I went to Google to see whether I can find the Hindi equivalent or the Kannada equivalent for Ajinomoto. And what I found was the equivalent for the Hindi equivalent actually translates into Chinese salt. And those of you who might have read a little bit about the history of the 20th century will realize that the last thing that the Chinese would like to be blamed for is something that the Japanese have done. And therefore one should be, it's important to know. Now lead. Lead of course comes from your pipes, probably comes from your water, and then one can ask the question, how did lead actually get into the noodles? Undoubtedly, when you process noodles, there must be a lot of water involved everywhere. One does not know what the source of this water is. But then, of course, you're not measuring the lead content in all the water that you have been drinking from different sources over time. But today, if you want to know anything about lead, it is so easy on the internet because you will find a site like this, where the entire periodic table is given. Most of the elements are colored. Every element that is colored dark, all you have to do is to click on that with a mouse and you come to a very authoritative article on that element. And therefore it is very easy for anybody to get themselves well informed on subjects connected with science today. Those of us who are older had very great difficulty actually in finding things to read. You needed to look for something that was hardbound, which was printed and so forth. But today you don't have to do anything except sit in front of your laptop or pad or whatever it is that you have, and all the information is available. Unfortunately, in that amount of information that is available, there's also a great deal of misinformation. And therefore, trying to separate out what is true from what is patently untrue is also somewhat difficult. But I noticed that in the title of your forum, or in the mandate for your forum, you've actually set for yourself the task of imparting wisdom. Now today there is a very great danger in distinguishing between three words. One is information, of which there is plenty. The second is knowledge. That of course must be distilled from the information. And the third, of course, is wisdom, which is even more complicated, which now must be distilled from the knowledge that you have acquired. So there's a lot to be read as far as science is concerned, literature. But before I discuss a very specific problem as to why it is important for society at large to have an understanding of science, I want to say a few general things about science. How is science done? Science is done primarily by observing and classifying. This is the way it was done in the 19th century. And the two major examples of observation and classification are the work that led to all our current understanding of biology and all our current understanding of chemistry and the materials that are present in everyday life. Darwin, of course, simply went around and observed. He observed nature, and by observing nature, he then began to think about what he had seen, and based on what he had seen, he came up with the idea of natural selection. So today, natural selection, or what we call Darwin's theory of evolution, really is central to an understanding of modern biology. Mendeleev, whose picture I have put there, is the one who gave us the periodic table. But when he constructed the periodic table, very few elements were present, but their properties were known. He knew that there was a certain periodicity in the properties. He was able to build a table with a lot of blank spaces, which eventually got filled over the next 50 years or so. And this is what is remarkable. This is observation and a synthesis of everything that you see. These are what in science you would call the grand synthesis. Pasteur, also in the middle of the 19th century, is the man who introduced the idea of experiment and observation. So now you do something and you make an observation, and based upon that observation, you now try to draw some conclusions and you come upon some kind of new fields. He's the one who gave us microbiology, vaccines, stereochemistry, optical activity. Pasteur's work in the 1850s revolutionized two disciplines, chemistry, medicine. And therefore, he's the man also who said that chance favors the prepared mind, which means if you're always doing something, you will observe something. But in order to make sense of your observations, you must always be thinking. So that is one way of doing science. A little bit later in the 19th century is when Michael Faraday did his work. Faraday did many, many things. So today Faraday is the scientist whom physicists claim as their own, chemists claim as their own, and electrical engineers claim as their own. And this is because in the 19th century there was no distinction between physics, chemistry, electrical engineering. And since most of you are students, I will also tell you the word engineering had not quite been coined at that time. The engineering is a very recent discipline. And everybody in the 19th century was a natural philosopher. This is why at the PhDs are still called doctors of philosophy, but they are doctors of anything except philosophy. So it is a somewhat of a misnomer, but that's where it actually comes from. Faraday really discovered electromagnetic induction. And most of you in school, all the science exhibitions that I've gone in school, the most popular experiments demonstrated by students used to have current flowing in a circular coil and show that it generates a magnetic field that can deflect a magnet. And the other is, of course, to have a rotating magnet and to show that you can get current. But just think about it for a minute. What this establishes is the connection between electricity on the one hand and magnetism on the other. But the amazing thing is, more than a century after Faraday, when I did my BSc, we were still taught electricity and magnetism as two different subjects. We had one book for electricity and another book for magnetism, but we would very rarely see in physics the connection between electricity and magnetism at the time that we studied it. But once you have drawn this connection between electricity and magnetism, what is the connection? Why are these two phenomena really now related to one another? That, of course, requires another synthesis. But what is this synthesis? This is a synthesis of human thinking. It is not a synthesis by observation and classification, but it's a synthesis of thinking. And that thinking was done by James Clerk Maxwell, again in the 19th century, a little bit after Faraday, where he unified electricity and magnetism in the first grand unification in physics. We are still looking for the second grand unification a long time after Maxwell. There's nothing like Maxwell's thinking which one must appreciate. What came out of Maxwell's equations? Today, of course, if you look at a textbook, students will find Maxwell's equations. You don't understand what they are, you don't know what's come out of them, and you just want to get it out of the way if you're in an examination. But what came out of Maxwell's unification remarkably was light. Light, the velocity of light just emerged from Maxwell's equations, and therefore Maxwell had unified not only electricity and magnetism, but he'd also connected them to light. And that is when one realized that electromagnetic radiation is really light. And what we see is electromagnetic radiation. What we don't see, all the frequencies, even those spectrum frequencies which Mr. Raja tried to sell, are electromagnetic radiation. And today everybody should know about electromagnetic radiation because you can make more money out of electromagnetic radiation than anything else. But the word spectrum, of course, to scientists means something else. Spectra are what you generate when electromagnetic radiation interacts with matter. But if it had not been for Maxwell, we would really not, of Faraday's experiment. Faraday was an experimentalist just like Pasteur. He did the experiment, saw this correction. Maxwell explained this correction. The last man whom I will really draw to your attention on how science is actually done is Boltzmann. And Boltzmann is probably one of the most interesting characters in science. On his grave in Vienna is this remarkable equation, S is equal to K log W. And that is the equation which tells you about entropy and a number of states of a system. So Boltzmann introduced the concept of entropy. Today, of course, entropy has entered the Oxford Dictionary. Now, we would say, for example, that the traffic in Bangalore has a very high entropy. Everything is moving in every direction in which it should not be moving. And people, for example, even on the new highways, you will find that people don't know how to drive on one lane, but will be changing lanes all the time. And there's a high entropy there. So we today intuitively associate the English word entropy with disorder. And there is no better exemplar of disorder than all of us collectively put together. Now on the next slide is something that I've taken from Jacob Bronowski's Ascent of Man, where he pays a tribute to Boltzmann. Now what was Boltzmann thinking about? Boltzmann at that time was actually thinking about heat, because in the 19th century, heat was very important because we knew that heat could now be converted into some kind of useful work. The steam engine had already been thought about. Thermodynamics was beginning to be born. And Boltzmann really thought about what is heat. And then he said that heat is not material any more than fire is, or any more than light is. Heat is a random motion of atoms. And when energy is degraded, said Boltzmann, it is the atoms that assume a more disorderly state, and entropy is a measure of that disorder. This is Bronowski's translation of Boltzmann. And when you read this, you can immediately see the connection to atoms. Boltzmann's already begun to think about atoms. But at the time when Boltzmann was thinking about atoms, no physicist was thinking about atoms. Physicists at that time did not believe in atoms. The only people who believed in atoms were chemists because they needed something to explain molecules. So the physicists often thought that the chemists were looking at some sensorial image which had no reality whatsoever. But Boltzmann realized that atoms would then explain many other things which were then common observations like heat. Boltzmann, of course, committed suicide because around the time in 1906, look at the date, 1906. I like the date 1906 because 1906 is the year in which the first director of the Indian Institute of Science arrived in Bangalore. So one of my first predecessor actually arrived in Bangalore in 1906. What was the state of science in 1906 when this happened? At that time in 1906, Boltzmann, in depression, committed suicide because nobody believed in atoms except him. And he was the founder of statistical mechanics, the man who gave us the connection between thermodynamics and statistical mechanics. But everything that happened in atomic structure theory happened afterwards, almost at this time when he died. After that, science progressed very, very quickly. It progressed so quickly, but sometimes, you know, societal understanding of science is very important. Look at Röntgen's discovery of X-rays. Today, when people ask this question, is it useful to spend money on research? This is the question that was very often asked. One of the reasons why I'm talking to you about this is, I hope that one of you will one day enter politics and win an election and become a minister and then sit in judgment on how money should be distributed. At that time, you should have a good understanding of what is the use of spending money on science. Will solutions come because you pose problems? Sometimes no. Solutions may come simply out of the blue. Here, Röntgen was simply doing experiments which he thought were worth doing, when he found that he was generating radiation, which when he kept a photographic plate on the other side, was in fact creating an image on the plate. So he called his wife and told her to put her hand in front of the plate, and the X-rays passed through her hand and then hit the photographic plate, and that's the image that he got. That is the image of Röntgen's wife's hand, which is available. And do you know what she said when she saw this? She's the first person, a common person, Röntgen's wife. She got her first X-ray image, and she had the most wonderful thing to say. She said, "I have seen death." Because that is what you end up as eventually, as a skeleton. And that is the image that X-rays really give us. But did the physicists think it was important? X-rays were a new form of radiation. Today, X-rays have taught us more about matter than any other form of radiation, because X-ray diffraction is a tool which has been used to determine the structures of crystals. But no, the physicists did not think it was very important. It was the doctors who saw this image first, who immediately realized that here was a way of looking at the bones in the human body, and therefore X-rays entered medical practice before X-rays became a subject for science. They're the most important tool in science, but nevertheless it was in medicine that X-rays first entered. The radioactivity and other things followed shortly thereafter. But today, in India, is an understanding of science important? That is the question which Shreyas and his colleagues have actually asked me to answer. So I will take one example. Because today, I don't know whether the government governs the country, but it's almost certain that the courts govern the country. Because if there is a dispute of any kind between anybody and anybody else, or between anybody and government, finally that matter is settled in courts. And once the courts have delivered a judgment, everybody accepts the judgment. Everyone's protesting on the streets, shouting, burning, breaking, everything. But if the courts pass a judgment that you should not do this, or this side is right, then everybody somehow accepts it. Now this courts now, the Bombay High Court, some years ago, declared this. They declared that steam is not a chemical. Now this is the High Court judgment. Now, is steam a chemical? Now, is it? I mean, you're students. You can have any answer. See, if you say that it's not a chemical, you might become a judge. If you say it is a chemical, you may become a poorly paid lecturer in some government college teaching chemistry. So is it a chemical or is not a chemical?
It depends on how you define it.
No, is science a subject of definition? Law may be a subject of definition. Science is not a subject of definition. Once something's there, it's there. Is it a chemical or is it not a chemical?
It is a chemical.
Perception maybe. Perception is a very complex word.
Yeah, the perception that a chemical is a reactive, physical substance is passive. So that is the ruling there.
Now I'll tell you what the ruling was based on. The ruling was based on the fact that there was this company in Bombay which was generating steam as a byproduct of the industrial process that they were using. Then they were taking the steam in a pipe and then taking it to the next plot of land where there was another company which would now use this steam. So they were selling the steam to their neighbors and making a little bit of money on it. The moment anybody makes any money, the government has to tax it. Now if they tax it, they have two kinds of tax. The sales tax on chemicals is different from the sales tax on non-chemicals. So the issue was the company wanted to pay the sales tax as a chemical, the government wanted the sales tax as a non-chemical. Now of course, like all legal matters, the tax assessment years were 1988 to 91 and the judgment came in 2010. By which time I don't know whether this company still existed or not, but the judgment came in 2010 and the judges of course knew that it was a chemical, but they then decided, like you, so you're all set to be a Supreme Court judge. Now, it says that in taxing statutes, words which are not of technical expression or words of art, but are words of everyday use, must be understood and given a meaning, not in their scientific sense, but in a sense as understood in common parlance. That's what the judges said. Now, in many ways, this is a dangerous judgment if you take it very seriously. Because there are many things in which if something's a chemical, you better understand it as a chemical. You can change the tax laws much easier. If Parliament found the time to make laws, they could change the tax form and say that chemicals have this tax, but the following chemicals are exempted and steam has to be paid at 10%. That is probably the sensible way of doing it. The result of this is that the Royal Society of Chemistry in the UK liked this judgment very much. So they immediately offered a prize of £1 million to anybody who could bring them a sample of a material which is free of chemicals. Now it turns out that there's no sample, anything that you can get which is free of a chemical, including your cells. Therefore, the understanding of the word chemical is very, very important. Right now in society, people think chemicals are harmful. They don't know they are also chemicals. Of course, sometimes they are also harmful, but that's not matter, but not everybody. So you must use terms correctly and have an understanding of it. Now, of course, I go to a more complex case, and this is the case that I really wanted to present to you so that you know how at all levels of there is a problem. The slide has disappeared a little bit at the top, but at the top I will just read. It's the name of a substance called Gleevec. Gleevec is a cancer drug. It's a drug used for a specific form of blood cancer. It has a technical name which is called imatinib. And Novartis, the company, markets Gleevec, you can see the name here, Gleevec, at 1,20,000 rupees for a month of treatment. An Indian company, Natco Pharma, produces the same drug and the treatment cost would now be 8,000 rupees a month. And of course, they have a patent. They don't have a patent. They're simply copying the molecule which is concerned here and then selling it. And the question, of course, is should this patent be allowed in India? So some years ago, the Indian Parliament passed patent laws, and those are the patent laws which are to be enforced in India. And there are many conditions of those laws under which very, very expensive drugs can now be compulsorily licensed in India and then sold at a lower rate. Now the question, of course, is should the Novartis patent on the substance imatinib be upheld or not? Now the case went through all the lower levels of the judiciary and eventually ended up about 3-4 years ago in the Supreme Court. And 2 years ago, the Supreme Court delivered a judgment on this. Now I'm going to tell you a little bit of the science behind Gleevec and the problems that the Supreme Court judges really faced when they had to hear this case. Because today you must understand this, because science, daily life, and the law are sometimes all interrelated. Yesterday, for example, you will find there's an argument in the Supreme Court on what is called the National Judicial Appointment Commission, where the procedure for appointing Supreme Court justices is being, validity of a law passed by Parliament is being debated by a 5-judge bench of the Supreme Court. In the arguments made before the Supreme Court a couple of days ago, a very prominent lawyer, Mr. Ram Jethmalani, has actually taken the view. He says, look, Parliament doesn't spend any time looking at all of this, so should their view on this be taken seriously? The Supreme Court, however, has made a very important observation, says that Parliament has to be taken seriously because that's the essence of the Indian Constitution. And the question is not whether the parliamentarians understood what they were passing the law on. Some of them would have understood it undoubtedly. Government would have framed the law. Everybody would have agreed on it. Afterwards, that we are only testing the validity of that law. And the government counsel who is arguing on behalf, the Attorney General who is arguing on behalf of the government to push the National Judicial Appointment Commission bill, he said, if you extend this argument, then you can ask the question, Supreme Court judges don't know anything about atomic energy, but they still decide a case which concerns atomic energy. So this is very important. So when you use the word society, remember that you yourself look at society as something distant. It doesn't concern you. But sometimes you may be in a position of having to take a view on something that you don't really know, but you should be able to have enough knowledge to be able to make a rational judgment. Effectively, what one needs then is only common sense. Common sense is actually trumps every other sense. And in the law, it is usually common sense which must prevail. Now, how did the company, why does the company patent this? The company patents it because it spent a lot of money on research. It has to recover that money by selling this drug, and therefore the drugs are very heavily priced. That's the molecule imatinib, which is a chemical structure. And here it tells you that there are good chemicals also which you want very much. And this is a treatment for chronic myeloid leukemia. And the case itself, the judgment was passed on the 1st of April 2013. The only thing unfortunate about this judgment, which I thought when it first came out, was the date on which they passed the judgment. They could have waited one more day and then given the same judgment. It would not have mattered because the case had been heard. But it is a wonderful judgment. This is probably a judgment in which really brings out, and I brought this here to explain it to you because it is this judgment which gives us great confidence in two of India's most important institutions, the Parliament of India and the Supreme Court of India, which are two of the three pillars of governance in India itself. And they dismiss this. They say, in view of the findings, they say that this drug fails in both the tests of invention and patentability. And here is a word which is very important when you deal with science and technology, the word invention. I come back to this. And therefore they say that this case is dismissed. And this is the judgment at that time given by Justice Alam and Justice Ranjana Desai. And I think this is a remarkable judgment which is available in its entirety. But when you look at judgments, of course, one of the things that you must remember is that there have been very, very scholarly judges who have commented on judgments of the Supreme Court. Commenting on the death penalty arguments before the Supreme Court, V.R. Krishna Iyer, who died some time ago, said actually this, and this is something that you must remember, said the Supreme Court is final, not because it is infallible, but it is infallible because it is final. And if you read this carefully, you will understand what he's really talking about. There's no other court of appeal. Therefore, whatever judgment comes from there, you accept it. But that doesn't mean the judgment is right. So one would have to study the judgment carefully, and occasionally the Supreme Court itself will reverse its own judgments some years later, which has happened in important constitutional cases. But coming back to the science, you don't have to worry too much about it. This is the disease. This is a stem cell disorder which leads to proliferation of myeloid cells. What happens is there's a chronic phase in the disease, there's an accelerating phase, but the real problem here is that the median survival after this is only 3 to 6 months. So most patients who have this disease are going to die within a very short while. So it is very important to have a drug which now allows them to live, and live even for some more time if that is possible. Therefore, many years ago, research on this began, of course, in the United States, where it was found that this was, in fact, a genetic disease. And as a problem, there was a genetic connection to this particular cancer. There's no genetic connection to some cancers, but in this particular case, a special case, there's a genetic connection to this cancer, and eventually genes translate to proteins. And there is a protein molecule in the body which is now has somewhat greater function than it should have. It's more active than it should be. One common way of trying to show this is that sometimes you have these pumps which work very well and pump water to your overhead tank, and afterwards the overhead tank continues to overflow because whatever valve you have there to shut this off does not work, and this thing now becomes a disaster of local flooding. Now, this is again a molecule which is going to produce another molecule, and now if it keeps on doing too much of this activity, that's also very bad. So you now need to stop this activity in some way. And the structure of this molecule is known, so you can now try to see whether you can find a drug molecule which will go in, block it, and stop the activity. This is the time scale on which all this research was done. This research began in 1990, it went all the way for about a decade or more, and at the end of it, one had the drug. But once one had the drug, it turned out that this was the fastest drugs ever approved by the US Food and Drug Administration, because they were under tremendous pressure from patients. And the data on which this drug was in a clinical trial, this is the overall survival rate in months after beginning of treatment. This is with standard chemotherapy, this is with interferon, and this is with the new drug. So you can see this is in time, in months, the survival rate for patients has gone up. So the pressure from patients and their families for this drug to be quickly released through the regulatory process was very, very high, so it was released. Now this drug is very useful, much more research has been done on this drug, which I won't worry you about, but eventually once this kind of lead is there, drugs are constantly improved by pharmaceutical companies, which then do chemistry, which makes the synthesis of the drug easier, the costs of the drug lower, and so on, and eventually you have many, many molecules which come. So the ultimate challenge of drug discovery is not in just finding one molecule which blocks the activity, but then developing it. This is what would commonly be called research and development. There's a research stage, and then there is a long development stage, and then there is a stage of clinical testing which takes even longer. So there will be quite a lot of money to be expended everywhere. Now, I might just go back for a moment. Where have I taken these slides from? That also is important. I've taken these slides from courses, educational courses, to pre-medical students given at one of Switzerland's most prestigious institutions, the ETH in Zurich. And this is among maybe the 10 or 15 best universities in the world. And you can see pre-medical students in these courses are in fact discussing this problem of the of drugs. There's no reason why we should, but we don't. Once a molecule is there, you can make lead enhance, make other molecules. Eventually, this has resulted in a whole lot of drugs. which are now all available for CML or chronic myeloid leukemia treatment. They're made by different companies, because once one company is made this, another company also wants to challenge this market. They will make another one. And the question is this molecule different from this one? Does a patent on this molecule cover this molecule? All of that has to be decided now by patent lawyers and judges who sit in trials in patent cases. Don't worry about this bottom. This simply tells you how today's genomics and other subjects which have created generate a huge amount of information, so you can in fact find out where all these molecules act and so forth. But just remember this molecule here. The molecule I'm talking about is imatinib. There's a competitive, another molecule called dasatinib. Maybe for my next slide. There it is. This is the molecule. This is by Novartis. This is by Bristol Myers Squibb. Abroad, this molecule can be marketed. This molecule can also be marketed. So in the United States, if you have chronic myeloid leukemia, or in Europe, if you have chronic myeloid leukemia, you can buy this or you can buy this. The doctor can try either one of these. The companies are not fighting with one another. But what happened 6 days ago is, 6 days ago, in a case which is being heard on the molecule dasatinib, the Delhi High Court now upheld this patent and prevented an Indian company from doing this. Whereas 2 years ago, the Supreme Court of India denied this patent and allowed another Indian company to market this. So there is no doubt that the dasatinib case will now also go to the Supreme Court. And when this goes to the Supreme Court, the judges now, of course, maybe both Justice Alam and Justice Desai, who were educated on all this chemistry which is involved, may no longer be there on the Supreme Court. Now there will be the process by which a new bench of the Supreme Court will hear this. So there cannot be a better example, I think, of the importance of science for society, because whether you're a lawyer or whether you're a judge or whether you're a businessman now wanting to put your money into the pharmaceutical industry, you might have some understanding of this. Of course, I won't worry about any drug will have resistance, so there is more research to be done to make more drugs and all that. But that's purely research. I would show these slides if I wanted more money for doing research. But for you, you're not going to give me any money, so I won't spend my time on those slides. But how much did this process cost? And why are we having this argument? This is because all people, health economics people, have estimated how much it costs Novartis to develop this drug. And they said it probably cost them about $96 million. Now, if you want to convert it into crores of rupees, you can multiply approximately today by 6.4. But instead, I will make this 100 and multiply by 600 crores. I'll put an extra 650 crores would be approximately the cost of drug development. How much does Novartis make in 2012? It makes about $390 million a month. And so you can see it makes about 4 times that. So their profits are pretty substantial. But of course, they lose a lot of money on other drugs which never enter the market. So you have to look at that also. But the general view of pharmaceutical companies, I'll show you in a minute, that there are many people who have done this. We won't worry about this very much. One of the things, of course, is that a lot of the basic research which was done, which led to this drug, was done in a university. So the costs of research are very small compared to the costs of development. But the Hindu had a cartoon about 3 months after this judgment had come out, and you can see that that's the view of big pharmaceutical companies. That's the patient who's represented as a cow, and then of course the pharmaceutical company is now milking the cow to the maximum extent. A cartoon which sort of summarizes the view of big business, which says that big business is making a lot of money from patients who require medicines at a much lower cost. So we have a bill, and this bill was discussed in Parliament, and this is the Parliament debate. And this is the view of an opposition member at that time, this was in 2004, who said, sir, even if this bill were only to affect India, it would still be extremely important. But it is a bill which affects most parts of the world. We are supplying 50% of the cheapest drugs, etc. And all these countries have complained about the high cost. So then he says, it is a bill that affects so many, do you not think we should have a slightly more serious discussion on it rather than attempting to just pass it? I think this would be applicable to many other bills which are considered in Parliament. But I must say that in this particular case, although very few members were present in Parliament, nevertheless the members who were present in Parliament spent the time actually discussing this bill. So this bill was improved quite dramatically by the kind of inputs which were given in Parliament by the few parliamentarians who actually discussed this matter. And then there was a government member who then allayed fears, and then the government member actually points to clause 3 of the bill, which now is chemistry. It says the mere discovery of a new form of a new substance, known substance, which does not result in the enhancement of the known efficacy of the substance, or the mere discovery of a new property or new use for a known substance, or the mere use of a known process, machine or apparatus, unless such known process results in a new product or employs at least one new reactor. As a consequence, this definition is there. You said something about we should define. The only place where you define things is in the law. And those laws have to be passed by Parliament, and when they are passed by Parliament, we interpret them, the judiciary now interprets them strictly in terms of the language which is employed in the bill. This is why badly drafted bills do more damage than the absence of a law altogether. Right now I would say that in the sector of higher education, there are more badly drafted bills which should not have been there in the first place for discussion. And the worry really is that some of these bills may get passed because Parliament will be so busy passing 25 bills on the last day of the session that they will slip through without anybody actually looking at it. So one must be very, very careful. So but the Supreme Court commented on this Parliament debate. It said the bill evoked a highly insightful and informed debate on the subject. To anyone going through the debate on the bill, Parliament would appear keenly alive to national interests. So this is a compliment of the Supreme Court to Parliament at a time when Parliament and the Supreme Court appear to be locked in a battle over the National Judicial Appointments Commission. And I think in the matter of affordable drugs, this is really how the Act was interpreted in Parliament, and they have even given explanations for this, but this was their final conclusion. And they said, what is being done here is a procedure called evergreening. So you have a molecule. So it is like the molecule I started with. If I sell you glutamic acid, and I sell you monosodium glutamate, I'm selling you the same. It's exactly the same problem. Imatinib and imatinib mesylate are actually the substance and the salt of the substance. So once you swallow it, you get exactly the same thing. And this is a business strategy in the industry which is called evergreening of a patent. And Parliament of Supreme Court of course recognized. Now you can ask for society, what do you learn from this? Are there any lessons to be learned from the Gleevec story? If India is to progress and get its own drug, more research, there must be more interdisciplinary research, there must be more medical research. And then of course you must motivate everybody, administrators, researchers, teachers, students, politicians, bureaucrats, everybody to understand a little bit, not very much, but a little bit about how these things actually happen. Disease itself, which we are all interested in, you can look at it, two kinds of diseases are there. A failure of biology, or I might say a failure of your chemistry, because biology or biochemistry finally, so it's a failure, diabetes, heart disease, cancer, neurodegenerative disease, all of these. And infection, bacterial, viral, fungal, malaria, H1N1, swine flu, whatever you call it, all the bacterial infections like tuberculosis, all of them. Now if you now really need molecules, you need chemicals, you need to evaluate the pharmaceutical usefulness, you need to test them, eventually to get them into activity. And this is the way things have been done. Testing on animal models, for instance, was the way artemisinin came from China. Today, for instance, testing on animals becomes very difficult because we have a lot of animal rights issues where testing on animals. Today's students cannot do a dissection. They must do a virtual dissection. But it would be very difficult to imagine that you would now be operated upon by a doctor who the first time he puts a knife on a human body is he's stopped moving a mouse, but he's really using his hand. You wouldn't like to really go under such a knife. So if you were now to contribute to an informed social debate on the importance of animal usage you will have to keep your sentiments behind. You will have to stop your business of, and I should say that even here, there is a point at which tradition, religion,